Hi everybody, we are Jan Drews and Thomas von Hahn from Asklepios Hospital in Hamburg, Germany.
And we are very happy to present our recently published PURPLE trial in gut.
So the PURPLE trial is a multicentre randomized controlled trial of the self-assembling hemostatic gel Purastat to prevent delayed bleeding after endoscopic mucosal resection. And it was a trial that was conducted at 15 centers in Germany and is now appearing in the current issue of Gut. So after EMR, there is a resection defect and there's a risk of delayed bleeding, which is about 5 to 10% in the colorectum and quite a bit higher in the duodenum. And we know from several randomized controlled trials that when you use hemostatic clips to close the resection field, to completely close it, you can substantially reduce the bleeding risk. The problem is that clip closure is difficult and doesn't work in many cases. Even in the trials, only in about 2/3 of cases, full clip closure was successful. Through the scope, endoscopic suturing devices may be an alternative, but they're also not that easy to use and take some practice, and there's no evidence for their efficacy in terms of preventing delayed bleeding. So if there was an easy way, such as applying a topical hemostatic agent to achieve the same effect, that would be quite fantastic, and that's why we conducted the PURPLE trial, which Jan will explain to you how it worked.
Patients eligible for our trial had flat lesions in the colorectum larger than 20 millimeters and in the duodenum larger than 10 millimeters, and were randomized 1-to-1 into a control group and the Purastat application group. The randomization took place right after resection, when the scope would be typically withdrawn. The primary endpoint of our study was significant delayed bleeding within 30 days assessed by a telephone interview. Secondary outcomes were, among others, wound healing and recurrence after 8 to 10 weeks and complications. For the primary endpoint, as you can see, significant delayed bleeding occurred in 11.7% of patients in the hemostatic gel group and in 6.3% of patients in the control group. This non-significant trend towards delayed bleeding in the hemostatic gel group also occurred in the colorectal and duodenal subgroup and was non-significant.
So in summary, in this randomized trial, we did not find any evidence for a prophylactic effect of Purastat gel when applied following EMR in terms of preventing delayed bleeding. The main limitation of the trial is its size, especially the low number of duodenal lesions included. So for any conclusions in this subgroup, one has to be quite careful. And it has to be said that for now, clip closure and the use of a cold snare, when you can do it and the lesion is amenable to that, seem to be the only evidence-based means of preventing delayed bleeding.
So this is it. Thomas, is everything clear now?
Well, it's of course only one study, and of course there are limitations. It's a trial of moderate size and there's some heterogeneity in the study sample. There are, as far as we know, at least 2 more trials coming forward, so we are excited to see what they show. But for the time being, I think there's really very little evidence to suggest that topical hemostatic agents can prevent delayed bleeding. So this is where we stand today, and we'll see what the future brings. Until then, bye-bye and thank you everybody.